Hello, for my video reflection on social responsibility, I'm going to be focusing on the healthcare industry. So I focused on corporate governance and social issues in marketing. Corporate social responsibility means that companies should act ethically and consider their impact on society and not just profits. An article that I found discussing corporate governance in healthcare is called Understanding Corporate Governance, a case study in 8 Australian hospitals. And one of its main findings was that the study identifies broader governance practices that support quality oversight, such as board orientation, skill development, agenda setting, regular review of reporting frameworks, and evaluation of board and committee effectiveness. The article's core argument is that simply performing the rituals of governments doesn't mean that boards are truly fulfilling their responsibility. For overseeing quality priorities, performance was generally weaker. Most hospitals have broad goals in their strategic plans, but these were often very vague and not translated into SMART goals, specific measurable priorities. As a result, boards struggled to track progress or connect high-level plans to concrete improvement work. External regulatory requirements often drove priorities more than internally chosen goals. And as a healthcare worker, I can speak to that. There's all sorts of outside governing bodies that the hospitals follow rather than using their own information, such as even HIPAA or the Joint Commission is mostly what influences hospital decisions. One corporate governance issue in healthcare marketing is the gap between what hospitals promote and how well they actually monitor quality and patient safety. The article I found, written mostly by Alison Brown, shows that hospital boards often review quality data, but sometimes not deeply enough to actually understand the problems, or they also don't have the clinical knowledge to actually fix those problems. This becomes a marketing issue because a lot of hospitals tend to advertise their high quality, safe patient care. They have the best patient care in the county, in the state, in the world, whatever. But if the governance is actually weak, those claims are not fully reflected in reality, and that can affect patient safety and the quality that patients view they're getting. So this can mislead patients and damage trust. One of the social issues in marketing is unequal access to information and care in general. Many healthcare campaigns are designed and aimed towards people who speak English and have easy internet access or have higher technological proficiency, such as logging into electronic healthcare platforms to access their information. This can exclude older adults, low-income communities, and non-English speakers. So marketing may not just serve people who need health care the most, such as old people or immigrants or non-English speakers. The most pressing issue for corporate governments, the most concerning issue to me is the corporate governance problem as it relates to marketing, because patients come to the hospital or to the doctor's office or to surgery places expecting to get very high quality and safe care no matter who they are. And if corporate governance and people in the C-suite and people in utilization review and all those places are not actually reviewing information and knowing how to actually apply that information to improve patient customer satisfaction, then it leads to safety issues and can affect patient trust. It's difficult because hospitals may appear to be doing the right thing on paper, but it's not actually happening in practice. So some solutions and recommendations and steps that can be taken by leadership would be to strengthen board oversight on quality and safety. They can set clear and measurable quality goals and then review performance in depth. They can also integrate actual healthcare professionals such as physicians, nurses, nurse practitioners, respiratory therapists, people that are actually on the ground floor and seeing safety issues, and add their insight to boards and governing bodies that are actually making the decision and setting budgets and all that. For marketing teams, they can make sure that the claims they're making in their advertisements and on the hospital walls and on the websites are actually reflecting the data that they are finding and that reflect the actual performance data. They can be transparent about their outcomes and their limitations and not try to stretch the truth. And then they can just continue working closely with the leadership and clinical teams. To wrap it up, marketing should reflect reality and not just promote an ideal image to draw people in. Overall, responsible marketing in healthcare depends on strong governance and a commitment to ethical communication, and that truly benefits patients and society.